Welcome back to our Celebrating Pride podcast. This is the series which explores experiences, stories and hot topics related to pride in healthcare in bite-sized formats. It was recorded with our panel of speakers earlier in 2023 in Nottinghamshire. We really hope you enjoy it. This is the fourth episode of this series, which discusses how to make primary care and GP practices a safe and supportive environment for patients and staff.
I just thought this led actually really nicely onto that discussion we were having about how to ensure that our environments are places where people feel safe and supported to come in and have an open discussion.
Yeah.
And it's incredible, isn't it? Because actually, I think even as GPs, despite us being quite open and very, I'd say I've seen a lot, even in the short career that I've had so far. I think we still make assumptions when people walk in. So Laurence, you're exactly right about that thing of, oh, is this your brother? This must be your brother, or this must be, your sister, or whatever it might be. But that's just because that's our norm. And sometimes we forget that actually there is a wider community and we need to, and so it'd be interesting to have a chat about symbols, and that idea of, well, actually what are things that we can do to ensure that our patients come through our surgeries and are happy to discuss openly? Because there are so many aspects of their health that will be affected by their sexuality. So how do we ensure that we don't miss something? I would welcome people from the panel to come forward and expand on that and see what your views are.
Andy?
Yeah, this was something I was thinking about ahead of the evening. So I was just sort of thinking, actually, what does this mean? Are there going to be some take homes for organisations, or for individuals going back into places where we practice medicine and healthcare? And I've also been I've been a patient as well. Actually, I've been to my GP. I've been in hospital. It's been things that might be relevant to sexuality, and I guess because I'm confident in those areas, I'm generally quite happy to share my sexuality when I feel it's relevant, but I feel a little bit uncomfortable doing that sometimes. And it's interesting, and I often make assumptions, and this may be controversial potentially in a way, but I'll sometimes make assumptions based on who I'm dealing with. Some healthcare professionals, you think, oh, this person seems like they might be gay, and I'm really happy to be open in those situations. Sometimes, particularly, I guess, with non-UK medical graduates, for example, or where there's language or there's a cultural difference between me and the person, and I'm not quite sure or as sure where that person might stand on these issues. I can feel more uncomfortable in those situations, and if I'm feeling that, I'm sure patients are. So I was sort of thinking, how do we go over that? And probably those people who I've been with would be horrified to think that I was feeling that way, but I was thinking, how do we get over that? And I was landing on this, well, is there something about signaling within the environment, using LGBT QIA friendly symbols, just to symbolize, just to signal the position of that organization and the people that work there. And I think even for me that would be helpful, when I'm feeling vulnerable in a healthcare environment. So I quite like the idea of symbols, as long as they're authentic, and they're not just there for show, or because the organization feels they need to be there. But so I've got quite a positive feeling about that. I don't think we always get it right, but that's where I stand, really.
I'm happy to say there's actually some evidence behind that being useful. We had a really good discussion sort of in our pre-discussion here about symbols and about what they mean, about, I suppose, like what one needs to show that you're actually an ally. But I'm just having a little look here at the LGBT Foundation Pride in Practice, which came after some of the quiz questions that we were going to come on to a little bit later. So there's the evidence across Greater Manchester. When services displayed LGBT posters, LGBT patients were 24% more likely to disclose their sexual orientation, 21% more likely to disclose trans status, but also trans people who disclose their trans status, the GP, dental, were 18% more likely to say their service needs were met, or say the service met their needs. And to me, admittedly, figures from Manchester and exactly what they've done. I think it's be worth finding out to see if we can emulate some of that. But that's really encouraging to me. If we're actually finding that people feeling more comfortable in practice are feeling like they're getting a better service and more comfortable discussing things both, I suppose, related to identity and completely not related to identity, to blood pressure, asthma, all those sort of things, it can only be better for the population. So I think there's something very much in that symbolism, as you said. So definitely things that maybe we can take away, those people listening at home. Laurence.
Yeah, I'm torn sometimes. So I like the idea of, say, displaying a flag. Which pride flag these days is perhaps a conversation for another time. But I think it has to be backed up, though, by some kind of awareness and some kind of discussion as a whole team, because as an organization, we can put it on our publicity or anything else, but actually, what does that mean, and how do we then own that and understand what that means if somebody approached us and asked us to be in our life for something? And I think that's really important. So it's got to be a good thing. It's got to be, it's got to be there. And I think we talked about this before, about sort of, it perhaps gives you that sense of safety and feeling comfortable. And I think that's perhaps where the Manchester example, James, comes in. I think I'm also aware we're in the middle of Pride Month, and in Pride Month, not in a GP context or a primary care context, what happens is big business decides to bang a rainbow and everything, and makes money out of it. And I think we also have to be aware that doesn't help, that doesn't demonstrate allyship always. It is about them making profit, and I think that doesn't always help people when they see a flag, to understand that actually it's not just about rainbow washing. It is about, it's got to be something more than that. We've got to have had the discussion internally with ourselves as a team to say, okay, what does that mean? We had a really healthy discussion in the training hub team a few weeks back, facilitated by somebody, and we talked about quiz questions relating to LGBT+. And, just sort of, I think for me, it was like, oh, this is quite interesting. But for me, it was also, gosh, this has sparked a few memories and issues that I'd forgotten about, that I thought, oh, yes, they there is a real difference in the way I have to live my life, or have lived my life, that other people don't experience. And I don't know that a flag necessarily makes me feel that comfortable, but I have to say I will look out for it. And I think Andy's right. I think it does sort of make you go, oh, okay, I might be treated better if I see the flag, but not always.
Yeah, that is, I think, very powerful statement there, Laurence. I think that authenticity of the symbols that we show, and whether you believe them, and evidence to me, show me how, show me what you're doing, rather than just show me the flag. It's important if we're to get people to believe us, and actually to maintain the value of those sort of symbols. Might come to you next, Beckie. What would you like to add here?
I was thinking we've had some conversation earlier. It gives you time to reflect about what it will be like to be an aging member of this community. I think one of my observations was some of the learning we can take from university students, and that accessibility. So I noticed, I come from Lincolnshire, and there's a wellbeing hub right on the university site, and that promotes all sorts of communities within that. So it feels less tokenistic. But actually what it has done, and this is a curiosity for us, is it's enabled lots of the students to feel confident to disclose about being transgender. But the challenge for us would be, are there the services around that to then support those individuals who have felt confident enough to raise their voice, share that intimacy about themselves, and ask for support, and is the support there? So a very different challenge, moving away from the flags. But the flags were visible, it enabled people to speak out, but then it develops that next bit of the conversation about the so what, how, what do we do now to back that up?
I think that's probably a big part of the challenge as systems, so small systems in GP practices, but larger systems as per, in the ICB, in our place-based partnerships. I mean, from I suppose the ICB point of view, Robbie, how do you think we can do this on a wider scale? And any comments on things we've just been discussing?
Yeah, Thanks, James. So I'm not going to walk myself into a promise here, but because I could quite easily do that now. But the pride in practice, as an example, is something that I think is really it is a really productive way of being able to do something that's measured and is comparable across the country, and brings some clarity for people that says actually there has been an assessment process. Now, I'm not saying that pride in practice, I'm not saying that that is the ideal process or assessment criteria, but something of that nature helps to be able to give some confidence and some reassurance to people that it isn't just tokenistic and, oh look, we're the PCN has sent out to every practice an envelope with 6 flags in, so we've put them up, great, we're suddenly inclusive, because that does feel really, really tokenistic. I think for me, almost taking it one step further, is it's less about having the really common visual stuff, so flags, lanyards, NHS rainbow badges, etc., while ever that's really positive because it sends the right visual message. I think for me it is the actions that sit behind that. So for example, and I'm not going to get into a debate about how NHS systems work, but we know that if I was trans, our NHS systems are often very sex-based and not gender-based. So actually, is there a way that some of the internal forms and structures within GP practices can change that so that the letters don't get printed out and still say, dear Mr. X, whoever it is, when actually I may be a trans woman, and just because it's something biologically related, but the templates that are all embedded within local systems mean that it prints out based on sex, not gender. So I think there's some real fundamental things that aren't easy fixes, but actually for me, it's those things that make the difference. Registration forms, do you ask what people's pronouns are, and do we record that on the system? Those kinds of things, I think, are the real fundamentals, and that would make me feel much more comfortable to disclose if I'd been asked right at the start which pronouns, what's your preferred name, etc., rather than just seeing the receptionist with the rainbow lanyard on, while ever that is good in itself as a visual aid. So I think there's a lot of the things that maybe aren't quite as overt that actually, for me, would make me feel far more comfortable, and I can go, yes, this practice actually understands LGBTQ plus issues, rather than the PCN has sent out an envelope with 6 flags in, and actually that we're going to put them up because we've been told we need to. So I think there's a balance of both.
A real challenge to figure out exactly what that looks like, because one needs good buy-in from the practice, but buy-in sort of, I suppose, both conceptually and the work behind it, but also buy-in from patients of people belonging to the community, but also those, I suppose, not belonging to the community, and having these conversations. We are talking about it now, which I think is enormously positive, but I suppose the population at large is at various levels of acceptance and understanding and engagement with this.
Some great practical ideas here to visually and practically show allyship across primary care. We will continue this discussion in the next episode, where we explore where system influence is needed to make practical changes across the integrated care system. We hope you've enjoyed today's episode, and we look forward to catching you at the next one.